Hello everyone. Today we'll be talking about skeletal maturity indicators. And welcome to the Department of Orthodontics. Myself, Dr. Rajiv. Okay, why is skeletal maturity indicator so important, especially in Department of Orthodontics? Because skeletal maturity indicators they acts as one of the main objectives of treating skeletal discrepancies is to take advantage of the patient's growth spurt, which help to achieve optimal results. So you've heard of growth spurts. That is when the growth stages or the amount of growth that gets accelerated. Okay, that is when it's called as growth spurt. So when you get to know about those growth spurts, we can accelerate our treatment plan. Whatever treatment plan is being planned for a patient, especially growing patients, we can go through it with the help of skeletal maturity indicators. Okay, hence skeletal maturity indicators helps us in planning according to the growth stage of a patient. The ability to predict the magnitude and direction. It does not only accelerates the growth while giving the treatment, but as well as it also helps us in change or variations that we can do in magnitude of the growth as well as the direction of the growth. So hence, if we control the magnitude and the direction at the at certain point of time, which is known as growth spurt, we can get the patient's profile or the facial profile or any dental profile into a normal basis. Okay, so it would enable the clinician to identify those require interceptive growth modification. That is, we are intercepting using skeletal maturity indicators at the time of growth spurts or other than growth spurts, we can intercept the growth mechanism, okay, using orthodontic treatment. The developmental status of a child is usually assessed in relation to events that take place during process of the growth. Thus, chronological age, sexual maturational characteristics, dental development, height and weight measurements, and skeletal age are some of the biological indicators. So, what they're telling us, it's not just skeletal maturity indicators, it is also the chronological age, sexual maturational characteristics, dental development, that is the dental age, height, and the weight. All these can contribute to your variations in the mechanisms, whatever you are delivering to the patient. Hence, other than skeletal maturity indicators, the other status or the developmental status of the child can be judged by menarche in case of girls, peak height voice in cases of boys, voice changes, and skeletal ossification. That is the skeletal maturity indications. Whatever we'll be studying about in the today's topic, as well as dental development. Assessment of skeletal age is important to know whether any growth remains in the individual and what percentage of growth can be expected. This is what the complete or the basis of a skeletal maturity indicators. Hence, what are the types of skeletal maturity indicators we can see in our body? One is hand and wrist radiographs, cervical vertebrae, as well as mid-palatal suture. These are some of the basic indicators which can be used, but there are also some advanced or the recent techniques that have been delivered. Hand wrist radiographs. The hand wrist is a region made of numerous small bones. These bones show a predictable and scheduled pattern of appearance, ossification, as well as union from birth to the maturity. Hence, this region is one of the most suited method for steady growth. Indications. What are the indications? It is prior to rapid maxillary expansion when maxillomandibular changes are indicated. Marked discrepancy between the chronologic and dental age. Orthodontic patients requiring orthognathic surgeries or the maxillofacial surgeries between 16 to 20 years of age. So, what are the bones? We'll start from uh, the basic bones or the bigger bones and then end up in the small bones. So distal end of radius and ulna were initially used for the purpose of age determination. So as we know, our arms contain or the hands contain two large or the long bones, which is known as radius and ulna. The distal ends of these bones will be used as or the stages of their ossification can be used as skeletal maturity indicators. Okay, what is distal? Okay, always remember this is a basic term. Distal is always away from the body, proximal is always towards the body. So if they say distal ends of radius and ulna, that means the ends of radius and ulna towards the palm of your hand, not towards the shoulder of your hand. Okay, so that means distal means away from the body, proximal in the sense towards your body. The carpals. The carpals are the eight small irregularly shaped bones arranged in two rows. So as I said, proximal and distal, they are arranged in two rows, proximal row and distal row. Proximal is your the bones uh, or the units arranged towards your body, and the distal row is away from your body or towards the fingers. The proximal row are this you have to by heart. That is like the proximal row being scaphoid, lunate, triquetral, and pisiform, whereas the distal rows are trapezium, trapezoid, capitate, and hamate. These are the eight small bones which are known as the carpals. Metacarpals. Then comes the metacarpals. Metacarpals are the bones or the short or the small five miniature short bones that forms the palm of your hand. Okay, these are called as metacarpals. They are numbered from 1 to 5. Starting from your thumb to your little finger, they are numbered 1, 2, 3, 4, 5. From lateral to medial side. All metacarpals ossify from one primary ossifying center located in the shafts or the body of the bone, and secondary center in the distal end, that is in the extremities or the away from the body end. Okay, and except first metacarpal where it appears in the proximal end. Except first metacarpal, that is in your thumb, it appears in the proximal end, whereas all the other four appears in the distal end. That is your secondary center appears in the distal end. Okay. Phalanges. Phalanges are the fingers of your hand. These are small bones which form the fingers. These are 14 in number, 2 for thumb and 3 for all the other 4 fingers. They are referred to as proximal, middle, and distal phalanges. The middle one is missing in the thumb, hence, thumb contains only proximal and distal phalanges. The phalanges ossification. Okay, this is the common stage of all the types of or the methods of hand wrist radiographs, whatever we're going to study in the further slides. This is the or the these three stages are the common mechanism or common form or common method what it undergoes, the bones undergoes to the from the first stage to the final stage. That is, first stage will be epiphysis and the diaphysis will be equal. That is the between the middle bone what you're seeing between two phalanges, it's a epiphysis. That width as well as the width of the distal end of the phalange will be equal. That is the first stage. Then epiphysis caps the diaphysis. That is the, as you see in the B diagram, the epiphysis, the small bone between two phalanges, they starts capping the distal end or diaphysis. This is the second stage. The final stage will be those epiphysis and the diaphysis starts fusing or it completes its fusion. Then comes to the, we'll talk about sesamoid bone. It's a small nodular bone, most often present embedded in the tendons in the region of thumb. Okay, what are these tendons? You should really know the name. That is adductor pollicis. Okay, this frequently asked question. Which tendon contains sesamoid bone? Okay, it's known as adductor pollicis. In the majority of healthy children, there is an established sequence of ossification for the carpal, metacarpal, as well as phalangeal bones, which is remarkably constant and same for both the sexes. What they're trying to say is, it is the ossification process is same for all carpals, metacarpals, as well as phalangeal bones, and it is almost same in both the sexes. The first ossification center appears in the hand and wrist radiographs is the capitate. Remember, the first ossification to happen is the capitate, and the last or the most often seen is the sesamoid of the adductor pollicis. As I said, the tendon name is known as adductor pollicis of the thumb. The first epiphyseal center to appear is that of the radius, distal radius, that is away from your body towards the palm. The distal radius is the first epiphyseal center to appear. followed by those of proximal phalanges, then the metacarpals, then the middle phalanges, distal phalanges, and finally the ulna. There are two main exceptions. Okay, this is what commonly happens while ossification stages are happening. But exceptions being the epiphysis of the distal phalanx of the thumb commonly appears at the same time as the epiphysis of the metacarpals. Okay, the epiphysis of the middle phalanx of the fifth finger, that is your little finger, is frequently the last one to ossify. Okay, these are the exceptions. The order of appearance of carpal bones. What are the order? Like this is now they're talking of appearance of the bones, that is during the birth stage. First one being capitate, then hamate, then triquetral, then lunate, then trapezium, trapezoid, navicular or scaphoid, and then finally pisiform. So I'll keep on showing the each and every bones. Okay. The capitate, the hamate, triquetral, this is a lunate, scaphoid, sorry, trapezoid. This is a trapezium. This is the trapezoid. And finally, pisiform. Okay, now talking about the radiological methods of assessment of prediction of skeletal growth. Okay, the first and foremost method is Grulich and Pyle method, which was the oldest method. It's the most prevalently employed. Even till today, it's most prevalent as well as mostly used method in hand-raised radiographs. Okay, for employed skeletal age techniques today. The standards established by Grulich-Pyle, how did the study go on? Okay, it consists of two series of standard plates obtained from hand-raised radiographs of white. That is, they're talking about the races. They're telling about white, upper middle class boys and girls, both the sexes they have included, enrolled in the breast foundation growth study. Okay, if they ask what was the study conducted by Grulich and Pyle in hand-raised radiograph, it is a breast foundation growth study from 1931 to 1942. Okay. Okay. What are the steps in this method, Grulich and Pyle method? To facilitate bone age assessment, skeletal development is divided into 6 major categories. One is infancy, toddlers, pre-puberty, early and mid-puberty, late puberty, finally post-puberty. Infancy. Infancy in females, it is from birth to 10 months of the age, whereas in males, it is from birth to 14 months of the age. All carpal bones. Okay, what happens in infancy? All carpal bones and epiphysis, all the epiphysis of the phalanges, metacarpals, radius, and ulna lack ossification. None of them have ossification. In the full-term newborn, as soon as the baby is born, the ossification centers of the capitate and hamate become apparent at the 3rd month of the stage, or when the baby is 3 months old, the capitate and hamate starts becoming apparent. Then toddlers, it is from 10 months to 2 years of age in females, whereas 14 months to 3 years of age in males. In toddlers, the ossification centers of epiphysis for the epiphysis of all phalanges and metacarpals become recognizable during this stage, usually in the middle finger first and the fifth finger last. So the epiphysis in case of toddlers, that is in 10 months, 2 years in females, whereas 14 months to 3 years in males, the ossification centers of the epiphysis starts happening. And where it happens? In the middle finger first, you can see in the middle finger or the 3rd finger, whereas the last one can be seen in the little finger or the 5th finger. Pre-puberty. Age 2 years to 7 years in females, whereas 3 years to 9 years in males. During this stage of development, the ossification centers for the epiphysis increase in width. This is what we spoke about, the common method, what happens, or the common stages the ossification undergoes in the previous slides. What we saw, that is, first epiphysis width will be equal to diaphysis. Second stage is the epiphysis starts capping the diaphysis, whereas the third stage being the fusion of epiphysis and diaphysis. So in pre-puberty, the epiphysis increase in width and thickness. and eventually assume transverse diameter as wide as metaphysis. This is the first stage of ossification, which happens in pre-puberty. Then all carpal bones, with exception of pisiform, okay, there were 8 carpal bones. In that, 7 carpal bones usually become recognizable before puberty itself, except pisiform. Remember, the pisiform is not yet appeared until 7 years of age in females, whereas 9 years of males in 9 years of age in males. Okay. Then coming to early and mid puberty. The epiphyses at this stage continue to grow and their widths become greater than metaphyses. Thereafter, the contours of the epiphyses begin to overlap or cap on the metaphyses. So, the second stage of ossification, what we saw in the previous slides, that is the capping of the epiphyses to the diaphyses, happens or starts in early and mid puberty. What is the age? 7 to 13 years in females, whereas 9 to 14 years in males. Yeah. Also, the pisiform and the sesamoid just medial to the head of the first metacarpal bone or your thumb become recognizable during puberty. So, in the pisiform and the sesamoid were absent in early puberty, whereas in mid puberty it starts recognizing itself. That is the pisiform as well as the sesamoid. Assessments are based primarily on the distal and middle phalanges. That is, the distal phalange is the final bone or the large bone, and the middle phalanges, their ossifications are reliable for the assessment at this point of time, that is mid puberty. Then coming to late puberty. Later stages of puberty and sexual maturity are based on the degree of epiphyseal fusion of the distal phalanges first, and then on the degree of fusion of middle phalanges. Late stages of the puberty and sexual maturity are based on the degree of epiphyseal fusion of the distal phalanges first. So the fusion of distal phalanges, that is the last bone, happens first, and then the degree of fusion of the middle phalanges, which happens second. This is the late puberty. It happens between 14 years to 15 years till in females, whereas 14 years to 16 years in males. Post puberty, age being 15 to 17 years in females, whereas 17 to 19 years in males. At this stage, all carpals, metacarpals, and phalanges are completely developed. Their epiphyses are closed. So, in case of post puberty, every bone, all the bones in your hand or the palm or complete hand and wrist, it's completely developed and their epiphyses are closed. That is the final stage of ossification. Assessments of skeletal maturity are based on the degree of epiphyseal fusion of your ulna and radius. So in post puberty, we'll be looking only for ulna and radius, not the other bones which have already completed their ossification stages. Okay, this was about. Okay. So until now we studied about Grulich and pile method. Whereas now we'll go for the next method, that is York, Grave and Brown's method, which was given in 1976. There are 9 developmental stages what York gave, whereas in Grulich and pile method it was only 6 stages. Remember, it's 9 developmental stages in York, Grave and Brown's method. So what are they concentrating on? The areas of ossification events in the areas of phalanges, carpal bones and radius. This method describes the relationship between the epiphysis and the diaphysis in 3 stages. That is, the width, which is equal, then the epiphysis capping, and finally the fusion. Okay, the first stage, PP2. PP2 stage is proximal phalanx is equal. That is, the width of the epiphysis as well as the diaphysis is equal in proximal phalanx of the second finger, that is your forefinger, occurs at 3 years of age before the prepubertal growth spurt. Okay, it occurs 3 years before the prepubertal growth spurt. Then coming to second stage, MP3. MP3 in the sense middle phalanx of the third finger or your middle finger is equal. That is, epiphysis is equal to diaphysis in the third finger. That will be your second stage. Coming to third stage, there are three ossification areas. That is, the pisiform starts appearing at first, and then hamate starts ossifying. Then the R equal stage. That is, the radius, epiphysis of the radius is equal to diaphysis at this stage. Then coming to fourth stage, the sesamoid starts appearing. That is, in the adductor pollicis of the tendon, which is attached to the thumb, whereas the hamate still starts or still continues its process of ossification, reach shortly before or at the beginning of pubertal growth spurt. So when you see a fourth stage or when you see a sesamoid appearing, that means it's the beginning of your pubertal growth spurt. Okay, this is the fourth stage of York method. Fifth stage, MP3 capping starts. That is, middle phalanx of the middle finger or the third finger starts capping. Then PP1 capping. You can see the proximal phalanx of the first finger epiphyses are being capping the diaphysis, as well as radius epiphysis is also capping the diaphysis of the radius. This marks the peak of pubertal growth spurt. So if you see the epiphysis of middle phalanx, proximal phalanx, as well as the radius capping, not the equal width, it is capping of diaphysis, then that means it's the peak of the pubertal growth spurt. This explains the fifth stage. Coming to sixth stage, that is DP3, distal phalanx of the middle finger or the third finger, and U stage, union stage, that is the distal phalanx of the third finger or the middle finger starts uniting or starts fusing. This constitutes the end of the pubertal growth spurt. So this is the end of the pubertal growth spurt. Seventh stage, the PP3 starts fusing. U means union. That means the proximal phalanx of the middle finger or the third finger starts fusing. This is the seventh stage. Eighth stage, MP3 union. That is, middle phalanx of the middle finger starts union or fusing. Coming to ninth stage, finally, the left out is radius. Okay, the radius epiphysis starts or completely fuses with the diaphysis. Ossification of all the hand bones is completed, and this complete skeletal growth is finished by this. If you see, the epiphysis of the radius has been fused to diaphysis of the radius, that means the complete skeletal growth is done. So after that, you can't do any growth modulations. Then Fishman skeletal maturity indicators. A system for evaluation of skeletal maturation was proposed by Leonard S. Fishman in 1982. Remember the name as well as the year, it's very important. It was given by Leonard Fishman in 1982. This system makes use of anatomical sites located on the thumb, third finger, fifth finger, and the radius. Remember what Grulich and Pyle noted, as well as York and York noted, as well as Fishman noted. Okay, they were concentrating on different structures, and they gave the different methods of hand wrist radiographs. So Leonard Fishman, he concentrated on thumb, third finger, fifth finger, as well as radius. Fishman system uses 4 stages of bone maturation. That is, epiphysis equal in width, which was common to the previous two, appearance of adductor sesamoid, capping of the epiphysis, fusion of epiphysis. Okay. SMI1, skeletal maturity indicator 1. The third finger proximal phalanx. The proximal phalanx of the third finger shows equal width of epiphysis and diaphysis. This is the SMI1. SMI2, width of epiphysis is equal to that of diaphysis in the middle phalanx of third finger. Okay. Then SMI3, width of epiphysis is equal to that of diaphysis in middle phalanx of the fifth finger. So first he spoke about third finger, then he went to third finger's middle phalanx. First was the proximal, then coming to middle phalanx of the third finger, whereas in the third SMI is talking about fifth finger's middle phalanx. Okay, this is how you have to remember. Then SMI4, he starts talking about appearance of sesamoid, where in the adductor pollicis of thumb. In SMI 5, capping of epiphysis is seen in the distal phalanx of the third finger. Okay, so now the initial stages of ossifications have been over by SMI 4. SMI 5 starts with the second stage of ossification, that is capping. Okay, SMI 6 says about capping of epiphysis seen in the middle phalanx of the third finger. SMI 7, capping of epiphysis is seen in the middle phalanx of the fifth finger. Then SMI 8, fusion of epiphysis and diaphysis in the distal phalanx of third finger. Finally, SMI 9, fusion of epiphysis and diaphysis in the proximal phalanx of third finger. SMI 10, fusion of epiphysis and diaphysis in the middle phalanx of third finger. Finally, the fusion of epiphysis and diaphysis of the radius. So remember three tips to how to remember SMI 11 or 11 stages of skeletal maturity indicators in Fishman's method. Okay, that is up to SMI 4 is talking about the initial stages of ossification. That is, the width is equal to the width of the epiphysis is equal to diaphysis. Whereas from stage 5 up to stage 7, he talks about second stage, that is capping. Okay, then coming to 8 to 11 completely talks about fusion of all these epiphysis to diaphysis. Okay, the easy way to remember is whenever you are reading about hand wrist radiographs, if you're reading about Fishman, try to write the numbers, stages numbers on your joints. That is, if they're talking about middle phalanx diaphysis, you have to write it here and the number. Okay, for example, SMI 3, what they're telling, width of epiphysis is equal to diaphysis of middle phalanx of the fifth finger. So I'll write middle phalanx, fifth finger. So I'll write 3 here at the middle phalanx. So if you write 1, 2, 3, 4, 5 up to 11, you can easily, whenever you see your hand, you can easily note it down or remember it. By this is how you can remember how to remember the Fishman's method of hand wrist radiographs. Hazel and Freeman. So we are done with hand wrist radiographs. Now we'll talk about the cervical vertebrae or CVMI, cervical vertebrae maturity indicators. Okay, so what is there are 6 stages in CVMI given by Hazel. So the first one is initiation. Initiation marks the beginning of adolescent growth. So this is where the adolescent growth starts. The cervical vertebral body. So here we'll be concentrating on C2, C3 and C4 of the vertebrae. That is cervical vertebrae. They are wedge shaped. Initially, in stage of initiation, they are wedge shaped with their superior borders tapering posterior anteriorly. Okay, they are wedge shaped and they are tapering, means they are decreasing in size or they are descending in the size posterior anteriorly. In C2, C3, C4, we are concentrating on C2, C3, C4. Their inferior borders are relatively flat. They are completely flat. Why flat? What we have to observe in the further slides, we'll see. Okay, if all these features are seen, 80 to 95% of the pubertal growth is remaining. This is what it means. Then coming to acceleration, that is stage 2. Acceleration of growth occurs. Here, the growth will be accelerated. Concavities, that is what we spoke in the previous slide. The bases will be flat in the initiation stage. Whereas when it comes to stage 2, it starts concaving, or you can see the concavities at the base of the cervical vertebrae in C2, C3 especially. Lower border of C4 will be relatively still flat. Okay, it's not started to concave, whereas it is still flat. C3 and C4 assume rectangular shape. They start appearing rectangular. So if you see all these features, it is 65 to 85% of pubertal growth remaining. Third stage, transition. Growth is still accelerated to reach peak height velocity. Now the growth speed is at the peak. Distinct concavity is seen at the borders of C2 and C3. Concavity starts developing in the lower borders of C4. So until stage 2, it was only C2 and C3 which showed concavity at the base, whereas at the C4, it is starting at stage 3. C3 and C4 are more rectangular. What we saw in the first stage was it was kind of squarish, whereas it starts becoming rectangular as it passes the next stage. Okay, 20. So if you see all these features, it means 25 to 65% of growth is still remaining. Coming to deceleration or the stage 4. Deceleration of adolescent growth spurt begins. That is, the speed starts slowing down. There will be slow decrease in the speed. Distinct concavities are seen in all three, that is C2, C3, and C4. C3 and C4 starts appearing squarish at deceleration. Until transition, it was rectangular, whereas come to stage 4, it is squarish. So if you see all these features, it is 10 to 25% of pubertal growth spurt, which is remaining. Coming to stage 5, maturation. Cervical vertebrae attain maturity at this stage. Concavities are become more accentuated. That is, you can see it more, or you can assume it more concave than being flat compared to previous stages. C3 and C4 are more squarish in shape, and finally, the 5 to 10% of growth spurt is, or the pubertal growth is remaining. The final stage, that is completion. Adolescent growth is nearly complete. More accentuated concavities. You can see more of concavity in this stage in all three, that is C2, C3, and C4. Shape of C2 and C3 is completely squarish and greater vertical dimension than the width. Until previous stage, it was horizontally more, whereas now it has attained vertical height also, which is more than horizontal one. So by this stage, it means the pubertal growth is complete with no more growth potential remaining. Okay, that was about cervical vertebrae. Coming to maturational evaluation of ossification of mid-palatal suture. So using mid-palatal suture, even the mid-palatal suture also indicates the maturity index. Okay, it was given by Bernal, Rivallo, and Fishman in 1994. What was the purpose? The positive correlation between adolescent maturation development and the approximation of mid-palatal suture. What is the method used? Occlusal radiographs to approx the mid-palatal suture. So basically what they're telling is the approximation of the mid-palatal sutures where all the three bones meet. Okay, that is using that approximation, they started finding out the skeletal maturity index. So this is a picture using the mid-palatal suture. So by this, we end with skeletal maturity indicators. Okay, thank you.